Suicide is defined as the act of intentionally causing one's own death, but mental health professionals say the conversation around suicide must go beyond definitions toward action. Statistics from the Community Relations Department of the Royal Grenada Police Force, RGPF, show that in 2024, Grenada recorded 7 suicides, all among individuals aged 20 to 29. Already in 2025, 2 cases have been confirmed, both involving young people. Licensed clinical community psychologist Mrs. Neela Fletcher Phillip warns that suicide must be taken seriously at every level of society. She also urges people to recognize signs of suicidal ideation or thoughts or ideas centered around death.
Suicide is a mental health issue that everyone should take seriously because it is everyone's business, or at least it should be everybody's business, because so many health challenges can result in suicidal ideation, intent, and in some cases, even completion. And so, my admonition to all of us as parents, teachers, and adults alike is to really be observant. Know the signs for yourself and take every threat or pronouncement of either ideation or intent seriously. Don't take it for granted.
Her comments come on the heels of 2 suspected suicides in recent days, a 15-year-old student and a 38-year-old father.
It's important to note that suicidal ideation doesn't operate in isolation of a challenge or issue of some kind. And one issue in particular it is often associated with is depression. So even before suicidal ideation becomes an intensified issue, there are some things that we can begin to look for, to observe. The person might become withdrawn socially. They may experience issues with sleep, either insomnia or hyposomnia. They may experience appetite changes, and this can often be seen either with weight gain or weight loss. And I know that we sometimes only associate an issue with weight loss, but weight gain can also be an indicator that something is not okay with this person. They may be experiencing difficulty in regulating their emotions. They may be experiencing anxiety. This person may feel hopeless or worthless and may verbalize that. And so these are a few signs that can be observed so that help can be given to lower the chances of suicidal ideation intensifying.
Experts are also raising concerns about what they call a suicide cluster, where multiple cases occur within a short period, heightening the risk of more incidents. Mrs. Phillip is also calling for changes to Grenada's laws, which still criminalize attempted suicide, reinforcing stigma and discouraging people from seeking help.
Suicide continues to be misunderstood in our society. And that is demonstrated in some of the archaic laws that we still have on our books, including the law that criminalizes suicide. And so we want our citizens to know that their lives have value by breaking the stigma around suicide and encouraging people to ask for help, because help is available. And this is why we call for policies and policymakers in the Caribbean to reflect on our understanding of suicide as a public health issue rather than a crime.
Grenada is said to be one of only 25 nations worldwide where suicide is still considered a criminal act. However, in January, the government and civil society began consultations aimed at decriminalizing attempted suicide, one step toward addressing the crisis. Mrs. Fletcher Phillip urges policymakers to go further by strengthening mental health services, promoting awareness, and ensuring that those in crisis have access to the support they need. If you or someone you know is struggling with suicidal thoughts, help is available. Reach out to a trusted friend, family member, or professional. You are not alone. Mental health advocates say ending the stigma and improving access to care could save lives. Reporting for GBN News, I am Nisha Paul.